Oxygen supply is one of the most critical services in Egypt's fight against the COVID-19. Demand for it has surged, forcing medical oxygen suppliers in the country to ramp up production. Correspondent Adil El Marouki reports.
In Egypt, oxygen is now prescribed as an essential in the treatment of all COVID-19 patients. That has spiked demand for the gas, creating a huge gap in the market.
Oxygen consumption in some hospitals increased from 7 to 10-fold.
That has created a black market for oxygen cylinders and gas regulators, which has seen some prices triple. Ministries of Health, Interior, Trade and Industry have created a joint committee to manage the supply gap and launch a crackdown on the black market.
Normally 60% of our production goes to healthcare and the other 40% goes to the industrial sector. Because of the COVID-19 pandemic, we've frozen our industrial deliveries and all our production goes to the medical sector.
The government has instructed all companies producing gases to maximize production capacity. Our truck drivers barely sleep now. Distribution fleets have never been so busy. We had oxygen reserves in our storage tanks. We are now withdrawing from them. There was a gap of 300,000 litres, and that has been quickly recovered with the steel companies joining us.
All major steel manufacturers have been instructed to decrease production so as to lower their consumption of industrial oxygen. Their facilities are now being used to increase the purity of the oxygen for medical purposes. Meanwhile, producers of medical-grade gases are expanding their production lines.
We've built this facility in less than a month since we became aware of the crisis. It is almost completed. We have missing electric panels from the National Electricity Company. They promised us to reduce their usual installation time to a third, but we need them to be even faster. The pandemic is harsh and we must fill the shortage in the market.
The COVID-19 pandemic has highlighted the importance of medical gases facilities in the healthcare system. And because of the sudden surge on oxygen, companies like this one have started to manufacture new facilities that will multiply the production of oxygen gas cylinders, which will be mainly used by individuals.